This is a tutorial of the app Neuro Toolkit for iPads using the Explain Everything app. Neuro Toolkit contains many useful and evidence-based examination tools for several common neurological conditions and injuries. If you are a clinician that works with patients in this population, it would be very useful. First, to download the app on your iPad, go to the App Store. The icon for the App Store is circled in gray here. Then, use the search bar located in the upper right-hand corner, indicated here by the green arrow. Type in the name of the app, Neuro Toolkit, and press Enter or Go. The search should only return one result. This is the app Neuro Toolkit. This app costs $2.99. It gives directions and templates for many neurological diagnoses. Click Download. At this time, your iPad may prompt you for a password and your Apple ID. Depending on your individual settings, you may need to fill this in now. After download, the app will now appear on your iPad. It is indicated here by the gray circle. After you open the app, this will be the home screen. It lists the different conditions that it has tools for. This first option is the NIH stroke scale. This then goes through all of the subcategories for the scale and prompts the clinician for the correlating answer. It contains information if you have questions about each criteria and also includes information on TPA. The next category is comas and concussions. It contains 6 different tools including the Glasgow Coma Scale, Anoxic Encephalopathy Prognosis, AAN Brain Death Criteria, SCAT-2 for sports concussions, Ramsey Sedation Scale, and 4-score for coma. The next heading is for subarachnoid hemorrhage and arteriovenous malformations. It includes 8 tools: Hunt and Hess scale, Fisher scale, a Givley-Carter system, modified Fisher scale, WFN scale, Spetzler-Martin AVM scale, Spetzler-Prompts classification, and AVM aneurysm rupture risk. The next option is for transient ischemic attacks, strokes, and intracranial hemorrhages. It includes 16 different tools. They are the NIH scale, the ABCD2 transient ischemic attack scale, the FAST screen, CHADS 2-score and VAS, HAS BLED score, the HAT score, Dragon score, Aspect score, ICH score, ICH volume and function score, Framingham heart score, Astral stroke outcome measure, 6 simple variables, ASCO stroke subtypes, and GWTG stroke mortality score. Epilepsy is the next condition, and this app has 6 tools. They are adjusted phenytoin levels, creatinine clearance, anticonvulsant dosage, AED renal impairment dosing, status epilepticus treatments, and the AAN epilepsy quality measure. This next category includes many different types of tools, including outcome measures, visual measures, and migraine tests. There are 7. These include the Glasgow Outcome Scale, the Modified Rankin Scale, Oxford Handicap Scale, Modified Ashworth Scale, the Snellen Eye Chart, the Midas Migraine Test, and the Cerebral Performance Categories Scale. For multiple sclerosis, there are 3 tools included: They include the EDSS-4MS, the EDSS calculator, and the McDonald criteria. This app offers 2 tools for Parkinson's disease. They include the UPDRS and the Parkinson's quality measures. The Geriatric Depression Scale consists of a series of yes or no questions that you can ask your patients to help determine if they have this disorder. The last heading is for neuromuscular options. These include El Escorial ALS criteria, the ALS-FRS, and House-Brackman facial nerve grading system. Now we will go through an example. Let's use the instance of a potential for concussion after a patient has hit their head. Select the heading for coma and concussion indicated by the green box. If this patient was an athlete, for instance in a soccer game, we could then use the SCAT2 sports concussion tool, again indicated by the green box. After selecting the tool, the questions begin. All the user needs to do now is to follow the prompts and fill in the blanks. At some points, the tool will prompt the clinician to have the athlete fill out a portion. After that part is complete, the tool will then prompt the athlete to return the device to the clinician in order to continue the exam. For the balance section of the exam, it will prompt the clinician to prepare the athlete about the test. It also has instructions available if needed. At the end, it will provide a score, which can then be emailed to the athlete, physician, parents, or coach, whoever needs the information. This has been a brief tutorial of the app Neuro Toolkit using Explain Everything.